Not coming? Huh? Just started. We're used to this tune. We're going to play it forever.
Please be seated. Good afternoon. I'm Connie Delaney and have the privilege of serving as the Dean of the School of Nursing at the University of Minnesota. On behalf of our faculty, staff, alumni, and friends of our school, it is my great pleasure to welcome you to the 2017 Spring Commencement. Today's commencement recognizes students earning the Bachelor of Science in Nursing degree, the Doctorate of Nursing Practice degree, the postgraduate certificate, the post-baccalaureate certificate, and PhD in nursing. So first of all, congratulations to all of you. To the Bachelor of Science in Nursing graduates, from our staff and faculty, we say to all of you from both the Rochester and the Twin City campuses, this is a major milestone in your life and your career. You are prepared to enter this magnificent nursing profession and welcome the multitude of career paths it offers. The nursing profession welcomes you. And to those of you earning a Doctorate of Nursing Practice, congratulations. You have attained the highest level practice degree for nurses and are now poised to lead, deliver, teach innovative, evidence-informed practice. You will each engage in leadership roles in the redesign of healthcare, and we deeply celebrate you. Within those earning the Doctorate of Nursing Practice degree, we celebrate another major milestone of this School of Nursing. We celebrate the first group of 37 Benson Scholars to graduate with the DNP degree. Recognizing the critical importance of educating more nurses with advanced practice degrees, the Benson Foundation established a generous scholarship for DNP students 3 years ago. The impact of this generation and of new graduates receiving this generous gift begins today, as these graduates leave here equipped to provide leadership, person-centric, transformational care, and care that advances access for all, quality, and lower costs. Let us thank the members of the Benson Foundation who join us here today. And to those of you earning a post-baccalaureate or postgraduate certificate, your commitment to lifelong learning and expanding your knowledge and skills to meet the needs of a constantly changing and transforming healthcare environment is absolutely lauded. And to our PhD graduates, while this day represents a culmination of your advanced preparation as nurse scientists, it also is a great new beginning. You will be leaders in nursing science, in academia, and in other corporate and policy settings. Your leadership in driving discoveries in full partnership with our transformational experts in clinical care will continue to move us toward better care and wise stewardship of healthcare spending. The future of nursing depends on your wisdom, your discovery, your partnership, your commitment to mentoring the next generation of nurses. and to our faculty, seated here on stage, and those that are unable to join us. Your commitment to the excellence of students and student education is outstanding. I am in awe daily of the inspiring example you set, your flexibility, intellect, innovation, team and interprofessional focus, your playfulness, and your constant priority that's placed on our students. Please join me in acknowledging our faculty. Graduates, you're now part of a proud legacy of innovation, leadership, and advanced innovation that defines the University of Minnesota School of Nursing. And today you inherit and affirm the legacy of the oldest school of nursing founded in a university. And you inherit another legacy, the legacy of this profession being the most trusted profession in the U.S. We know you are prepared to honor, preserve, and advance these legacies. Each one of you arrived at this very defining moment thanks to your intellect, your soulfulness, your work ethic, your spirit of collaboration and curiosity, and your courage. These are rigorous programs. We know it. We know they're demanding of the very best from you every day. And now I ask you to pause, to reflect on those who have helped you along the way. Reflect on your parents, spouses, partners, children, friends, mentors, tutors, classmates. Reflect on those that without whom you may not be here today. Let's take a moment to express our deepest gratitude to the people who have contributed to your success. We consider all of you part of this School of Nursing family. I am honored to introduce Dr. Tucker Levine. Tucker is Associate Vice President for Research with this University of Minnesota Academic Health Center. Tucker brings you greetings on behalf of our Academic Health Center, Health Sciences in the University of Minnesota. Dr. Levine.
Thank you very much. So I'm looking out here. I almost feel like this is a Rodney Dangerfield moment. What a crowd. I mean, this is incredible. So thank you very much, Dean Delaney, Regent Johnson, faculty, colleagues and guests, graduates, family and guests. On behalf of the Academic Health Center, I bring you greetings on this perfect spring day to celebrate this remarkable graduating class from the School of Nursing. For those of you who aren't aware, the Academic Health Center at the University of Minnesota is a matrix organization that, in addition to the School of Nursing, includes the colleges or schools of medicine, dentistry, public health, the vet school, and pharmacy. The collective AHC has about 1,500 faculty. At any given time, there are close to 4,800 students matriculated in our professional schools. And during the annual spring ritual, about 1,300 students graduate from our professional programs. And we're proud of these numbers, and also proud of the fact that within the state of Minnesota, approximately 70% of the healthcare professionals graduated from the schools and colleges of this Academic Health Center. So I have two brief messages. One is for the graduates, and the message I have from the AHC, and I believe from the School of Nursing, is not only congratulations, but don't be a stranger. You know, some would say that this is the end of the beginning, if you will, but in many ways, we believe this is the beginning of what we hope will be a lifelong relationship with all of you. We want to hear about your achievements. We want to follow your trajectories. We want to learn about your accomplishments. And we do hope that you won't be a stranger and that you'll find your way back to campus when the Spirit moves you and in the appropriate context, and that you'll really develop a partnership with the AHC, and we hope speak very fondly and proudly of the education that you've been provided by many of the individuals on this stage. Finally, and although I don't have to curry favor, in my opinion, and a graduation like this is for the graduates, I want to take a very brief moment to acknowledge, in my opinion, the extraordinary accomplishments and leadership of Dean Connie Delaney. I have worked with the Dean for the better part of 7 years, and for those of you who know her, and maybe those of you who don't, I can tell you that she is a force of nature. And a significant amount of the School of Nursing's identity in 2017 is a function of her innovation and her vision for the school. She makes the school look good, the academic health center look good, the university look good, and the state look good. So, Dean Delaney, I would just like to lead a round of applause for your leadership. Thank you.
Thank you, Tucker. I'm humbled. And the faculty and staff in our school know that. Yeah. It's now my honor to introduce our commencement speaker, a multifaceted corporate leader and visionary. Cindy Kent is the president and general manager of the 3M Infectious Prevention Division. And prior to joining this 3M and this division in 2013, she was general manager for the Gastrourology Therapies Unit for Medtronic. And before this, she held leadership roles in Eli Lilly for almost 15 years. Cindy Kent holds a bachelor's degree in industrial engineering from Northwestern University in Illinois. She holds an MBA in marketing and a Master of Divinity from Vanderbilt University, Tennessee. Cindy Kent has been recognized by many for her leadership and her capacity to inspire. Let me share just a few examples. She was selected as a German Marshall Fellow in 2007. She represented the U.S. to officials in Germany, Turkey, Slovakia, and Belgium. In 2008, she was recognized by the Twin Cities Business Journal as a top 40 under 40 business leader, and most recently was recognized by the Twin City Business Magazine as one of the 6 Wonder women in 2015. Please join me in welcoming Cindy Kent.
Thank you so much, Dean Delaney, and greetings to you all. It's my pleasure to be here. So good afternoon to each of you. To you, Dean Connie Delaney, to Regent Johnson, to all the faculty and the staff that are here today, for such a gracious invitation to join you all. As I mentioned to Dean Delaney when she extended this invitation, speaking at a commencement as the keynote address had been on my bucket list. Except I thought it would be many years from now when I was older and wiser, more importantly wiser, and never imagined that it would be at such a distinguished institution like the University of Minnesota's School of Nursing. And why so distinguished? It's part of the legacy that Dean Delaney just mentioned. It's the first school of nursing to offer a doctoral of nursing practice degree in nurse anesthesia, nursing informatics, health innovation, and one of my personal favorites, leadership. It's the largest full-time DNP program in the nation. It's ranked second in its informatics program. And with over 900 students enrolled, 247 who are graduating today, in 2016-2017 academic year, it provided over $1.7 million in scholarships. So I am delighted to be in this distinguished institution with you today. And one of the most important things about coming and sharing with you is the message that the universe is sending to you right now. This dream come true for me should function as a proof point for each of you that when you open yourself up to the possibilities, that wonderful things are in store. Thank you also to all the family and friends that come to share this day with the graduates. It is because of your support of the graduates and whose support has endured through their journeys that got them to this day. You are not only key factors in their journeys and key factors in their community, you are factors and play important roles in all of our beloved community. That community is formed by those who have loved us and who have stood by us through the ups and the downs, through the zigs and yes, those unfortunate zags. I hope that all the family and friends here feel the warmth and the love and the gratitude that the graduates are extending to you in this moment. I want to just pause and take it all in. I've sat where you've sat. I've been where you've been. This will be such a spark in time, so I want you to savor it. And you, class of 2017, congratulations. How absolutely stoked you may feel, you must feel, not just because it's your graduation day, but how cool is it to be graduating from the School of Nursing during National Nurses Week? How cool is that? How cool is that? I personally think that there is something so fortuitous about that. And it's another positive proof point that your future is oh so bright. So bright, in fact, that I'm shocked that any of us sitting up here could even look at you without our polarized Ray-Ban sunglasses. You're just that bright. So congratulations, class of 2017. And when I say your futures are bright, in all seriousness, it is not some disingenuous commencement platitude that they're paying me to say. Trust me, that's not the case. Nor is it any obligation that I have to tell you that because it's graduation day. But from someone who has worked in healthcare over 25 years, I see what is needed and what it takes to succeed in this hardcore industry that we call healthcare. And the more I research the nursing program here at the U, I tell you, and believe me when I say, if you take what you've learned and you apply it to the workforce when you leave here, you will be so well prepared to seize the opportunities in front of you, the opportunity to leave your indelible marks, not only on the industry, but upon the world that at this point in time is in desperate need of transformation. And you have the capacity and what it takes to make those much needed changes. Specifically during my research, I kept coming across the phrase, explore, engage, excel. Explore, engage, excel. all over the website. I'm sure that you've heard it and seen it so many times that you don't even think about it anymore. But those 3 words, explore, engage, excel, are like sides of a prism. While nice at first glance, if you take a deeper look and you begin to turn that prism around in your hand, you can observe that these are also key attributes that will serve as beacons to your North Star to guide you on your journey of purpose. So I encourage you to explore the world that is before you. And although sometimes it's going to be tempting some days to completely check out, I encourage you to engage by figuring out your role in this great planet we call Earth and what it must take from you for you to make it better. And then excel at whatever you determine that your contribution to the world is going to be. When I think of the word explore, for me, it means continuing every single day to see the world, the people, and the issues within it from a fresh perspective. Not allowing yourselves to be cynical curmudgeons, frustrated, yet not taking an active part in making an effort to make things better. Just like that prism that I described, when you hold it up to the light, each angle, like every experience, not only that you've had, but that you will have from this day forward, if you allow it, will reveal something new to you and your life's purpose. When you lean into all the zags that this life has to offer, you must commit to allowing those experiences to make you better, and not to make you bitter. With 160,000 to 175,000 nursing students graduating in the United States this year, you are becoming a part of a 3 million person workforce called nursing, with experiences and insights to solve some of healthcare's, if not the world's, greatest and toughest problems. Over my career, while I've been consistently in healthcare, I've worked in every single function, manufacturing and in marketing and in human resources and in sales and in operations. And in the beginning of my career, I had a mentor who said to me, Cindy, take the first 5 years of your career as a young engineer and you go do as many jobs and take as many roles as you can, and you determine with informed knowledge what it is you want to do next. Essentially, what he was saying to me then is what I'm saying to you today. Go and explore. My wish for all of you is that you will continue seizing, and even better yet, creating the opportunities as you move through your career. Exploration is about each of you finding your why. As one of my favorite authors, Simon Sinek, always says, start with the why, and that's what exploration is about. Engagement is where you take those lessons and apply them to the causes that you will take up in the world. Not too long ago, I visited one of my business customers in Chicago, and I saw something on campus that I had never seen in all of my career. Every single one of their conference room on this large 5,000-acre campus was named after a female nurse. These rooms featured stories of each of the women and what they had accomplished. And I must admit that I made just maybe 2 extra trips to the restroom just to keep coming back and reading those profiles and descriptions of those great namesakes for whom the rooms were named. There was Mary Ezra Mahoney, the first African-American woman to become a registered nurse. There was also Clara Barton, the founder of the American Red Cross. There was Mary Walker, who served as a nurse in the early American Civil War that remains one of the only women to be rewarded a Congressional Medal of Honor. These are the giants whose shoulders you are standing on today, and whose shoulders the prestigious field of nursing was built upon, not only for the women, but for the men here today too. Howard Zinn once said, "Small acts, when multiplied by millions of people, can transform the world." And with 3 million nurses in the United States alone, I am counting on a whole lot of transformation because the patients need it. Really? Because the world needs it. The world needs each of you because each of you are the change that we have all been waiting for. My challenge to you today is that you engage, that you look at the world with wide open eyes and wonder, and you decide. You decide what seemingly small act you will lay claims to. How will you put your healing hands to work in this world? And whatever you do, do it well, as my grandmother used to say. And that brings us finally to excel. In Return to Love, Marianne Williamson, in my favorite quote, wrote that our deepest fears is not that we are inadequate. Our deepest fears, graduates, is that we are powerful beyond measure. It is our light and not our darkness that most frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, and yes, even fabulous? Who are you actually not to be? You are all children of God, and playing small does not serve the world. There is nothing enlightened about shrinking so that other people won't feel insecure around you. And as we let our own light shine, we unconsciously give other people permission to do the same. And as you are liberated from your own fears, your very presence will liberate others. You are graduating with nursing degrees today, each one of you becoming part of this 160,000 to 170,000 individuals who will do so. A degree that is cited by the Bureau of Labor and Statistics to be one of the greatest areas for job and wage growth in the foreseeable future. And with perseverance that you've demonstrated already by earning your degrees, I know that you know something about excelling. Part of living an authentic life, of letting your light shine, is bringing your whole selves to everything you do in an integrated way. As someone who has an engineering, a business, and a divinity degree, and is also a member of the ordained clergy, I have both an intimate understanding as well as personal experience of the value and the importance of integrated healing. Trust me, it all matters. There is no beginning nor ending to personhood nor to health. It's all connected. We are all connected. Let me leave you with this final thought, and it's a rule that I learned in divinity school. If you choose to stay in nursing, and 85% of nursing graduates do, or if you decide to go in any other area of healthcare or a service industry, remember this rule. Self-care is your first ministry. Self-care is your first ministry or obligation. Caring for yourself is how you ensure that you have something left to give to others. It is true in every service profession, and I'm sure the noble field of medicine and nursing, even more so than most. So work hard and enjoy the fruits of your healing hands. Enjoy today, your graduation day, and all the days that will come after. And let me be the first to thank you in advance for what healing you are about to bring to this world. Again, congratulations to this awesome class of 2017.
Thank you, Cindy. I want to particularly celebrate your emphasis on integrated health and healing, care of self, and raising our focus to the health of all of humanity and the earth. Next, it's indeed my pleasure to introduce our student speakers, Emily Jasperson and Cheryl Ramstead. Emily is representing the Baccalaureate of Science and Nursing graduates today. She grew up listening to her mother and her grandmother exchanging stories from their careers as nurses. Eventually, she felt called to join them in the conversation. She earned a bachelor's degree in psychology and the classics from St. Catherine University before she entered the BSN program on our Rochester campus. This past year, Emily participated in a program in India where she attended the Tibetan Medical Institute and held an audience with the Dalai Lama. While in the BSN program, she served as a board member of our chapter of the National Student Nurses Association. Emily is an active volunteer in her community, and she currently works as a nurse technician on Mayo Clinic's organ transplant unit. This is where she will also transition as she begins her career as a registered nurse in July. Following Emily, you will hear from Cheryl Ramstead. Cheryl represents our doctoral graduates today. Cheryl is earning her Doctorate of Nursing Practice degree in Health, Innovation, and Leadership, with a minor in Integrative Therapies and Healing Practices and a certificate in Healthcare Design and Innovation. Like many who are called to nursing, her journey carries with it the spirit of caring and a call to make a difference. But listen carefully, as her story is also unique. After spending 37 years in the legal profession as a trial lawyer, then serving as Commissioner of Corrections for the state of Minnesota, and later as a judge, Cheryl became a nursing student in 2012. She completed her Master of Nursing degree in 2013. And as you can see in your commencement program, every DNP graduate completes a scholarly project. And if you'll particularly note in that program, the titles of these scholarly projects are listed after every graduate's name. These projects represent important transformational impact on health and in our healthcare delivery system. Each student identifies a healthcare practice challenge or a policy issue and recommends a plan for systemic and systematic improvements. A great many of these recommendations are implemented in real life as a result of the student's work. And for her project, Cheryl studied burn care in Peru, and she recommended how to systematically implement a new standard for burn care for patients in this resource-poor nation. This important project points to the need for one standard of care worldwide and our role in supporting that dissemination. We look forward to hearing from both graduates. I first invite Emily to the podium, who will be followed by Cheryl.
Thank you, Dean. Isn't this the best day? It's such an honor to be up here representing the BSN class of 2017. I am so proud to be a part of a cohort of students who have all proven their passion for this profession. I hope that what I say today rings true to all of you. I brought this card up here with me today to take us all back. Rainey, I see you. To take us all back to one of our first days in the program. Our instructor, Rainey Link, gifted us all with a card like this, which reads, "I am the student nurse." He had us chant this phrase repeatedly while we laughed and maybe even rolled our eyes a little. But each week, we came to class and we put these cards out on our desks, and they reminded us of our importance as student nurses. I know we all had a moment in clinical when we wanted to tell a questioning physician, "I'm just the student nurse," but stopped short, remembering these words. As you can see, faculty and staff, the ways in which you encouraged us, even from our first moments, were impactful. I would like to thank you, for you have influenced each and every one of us positively, as future nurses and as human beings. You have laid the foundation for our careers, and that is an honorable job. Thank you for devoting your time, your energy, and likely a bit of your sanity to us. We appreciate you. I'd also like to extend congratulations to the other graduating students here today, some of whom gave lectures in our BSN courses throughout the years. Thank you for your devotion to our nursing education, and we truly wish you the best in your future endeavors. Now I'd like to speak directly to the friends and family who so kindly came to celebrate with us today, for as other speakers have said, you might be most important of all. You've likely answered late-night, tearful telephone calls, you've talked us out of quitting, and you've inspired us to push past life's obstacles time and time again. You listened to our disgusting stories, you let us poke and prod at you for practice, and you still showed up today. You have loved and nursed us all the way here to graduation, and you might deserve an honorary diploma for that. We thank you. I'll speak for all of us when I say that being more than just the student nurse has been one of the toughest jobs any of us have faced. Classmates, look around you. Really look at the people sitting near you, because those are the people who not too long ago panicked over testing out on taking someone's pulse. Flash forward 3 years and you're high-fiving those people after sinking NG tubes, surviving 12-hour overnight ICU clinical shifts, and after writing publishable nursing research reviews. To quote Dr. Ruth Lindquist, we are stars. We've also encouraged one another after we said the wrong thing to a patient, and we've cried over exam scores together, or anticipation of exam scores. We have been dragging each other to the finish line for 3 years, and through the good and the bad, together, we made it here. In a few moments, after we walk across this stage, the words on this card are going to have to change, but what they mean to us won't miss a beat. Embody the confidence instilled in us by these words as you embark on your next adventure, whatever it may be. Refer to this on your toughest days at work when you need a reminder of your importance. I hope you never forget how accomplished you feel right now. And may you always be proud to say, I am a nurse. Congratulations and good luck to you all.
Thank you, Dean Delaney, for your kind introduction. Little did I ever think that I would be attending a School of Nursing graduation, much less be hooded by my two mentors and sharing this day with my special nursing colleagues, our families, and our friends. I always wanted to be a lawyer. I grew up watching Perry Mason on television, reading Nancy Drew mystery novels. I'd never been around hospitals or been a patient myself. I finished law school and was living my dream as a federal prosecutor when suddenly everything changed. On July 7th, 1979, I was on my first solo flight when my plane crashed in a densely populated St. Paul residential neighborhood about half a mile from the state capitol. After breaking down the door and climbing out through fire, I crossed the street where I collapsed in front of a Catholic church. The priest came out and gave me last rites. In a flash, my life was turned upside down. That morning, I'd been training for a marathon, and by afternoon, I was fighting for my life. The ambulance took me to the hospital, where I spent the next 2 months with 37% of my body burned, underwent 7 major surgeries, and had a 10% chance of survival. Some might say I had a crash course in the importance of nursing as I underwent the long, difficult road to recovery. During my hospitalization, one of the nurses challenged me to run Grandma's marathon. Thanks to that nurse seeing me as a person, not simply as a patient, she recognized my passion for running and inspired me by giving me a goal that sustained me through 2 years of daily physical rehabilitation. Another nurse saved my life when she called in the surgical team on a Sunday night to do a 6.5-hour operation because she realized I wouldn't make it to Monday morning. I owe a great debt of gratitude to these nurses, and I knew always that I needed to give back because I'd been taught to whom much is given, much will be required. I began taking prerequisites for the Master of Nursing program, one at a time over a 4-year period while I was sitting as a full-time judge. I did it quietly, on my own time, without others knowing. When I was accepted into the Master program, I resigned my judgeship without telling anyone I was going to become a full-time nursing student. After graduating, I entered the Doctor of Nursing Practice program in Health, Innovation, and Leadership. HIL has 5 pillars, which is HIL is shorthand for Health, Innovation, and Leadership. We refer to it as HIL. Those 5 pillars are design thinking, partnership and interprofessional practice, systems thinking, quality and safety, and global perspective. Those 5 pillars are as meaningful to every nurse as they are to HIL, whether we're in academia, research, at the bedside, or as administrators, for the following reasons. First, design thinking provides a solution-based approach to problem solving. As nurses, we need to be ever mindful of the end user, who is the patient. We must learn from the patient's perspective. Just as the nurse challenging me to run a marathon understood what an important motivator that would be. We must get to know our patients as people, not just by room numbers or initials. Second, patients should be our partners. They must be engaged and empowered. We need to use language they understand so that they can participate in their care. We must partner with our interprofessional colleagues, working effectively as teams to ensure that our patients' care reflects the very best that each of us can give. Third, systems thinking focuses on taking a holistic approach. looking beyond our individual disciplines to ensure that healthcare is coordinated to meet patients' needs. Fourth, and underlying these first three, is quality and safety. The United States spends more on healthcare than any other nation in the world, yet still ranks poorly on virtually every measure of health status. Americans take great pride in ranking first in terms of wealth, number of Nobel Prizes, and military strength, but pay very little attention to trying to become number one in health. We are at a game-changing time when nursing must assist in reframing, rethinking, and redesigning how healthcare can be delivered to ensure it is safe, effective, efficient, patient-centered, timely, and equitable. Fifth, and finally, global perspective. It's not new to nursing. 197 years ago today, Florence Nightingale was born. As the founder of modern nursing, she inspired the Nightingale Pledge, which includes a vow to zealously seek to nurse those who are ill wherever they may be. By working on the battlefields during the Crimean War to extinguish diseases and improve living conditions, she lived the motto, one world, one standard of care, which is even more important today as we witness health disparities worldwide. As nurses, we cannot predict the lives we will change by considering our patients as part of the solution instead of the problem, and partnering with them, as well as by ensuring that the entire system is working together to provide their care. Although we have each taken our own individual paths, as nurses, we all share one thing, and that is, for us, nursing is a calling. Regardless whether a BSN, DNP, or PhD, may our lives always be devoted to service and to the high ideals of the nursing profession. Thank you for allowing me to share my journey with you, and congratulations to you all.
Excuse me just a minute. Thank you, Cheryl. We absolutely celebrate both Emily and Cheryl's comments, and as you can see, there are themes that just permeate the world and the life in nursing, and not the least of which is the energy and commitment to make bold change and transformation. Thank you very much. Next, I will invite Alice Nagel-Sanders to the podium. Alice currently serves as the president of the University of Minnesota School of Nursing Alumni Society Board. Alice is the program manager of Care Support Services at Medica. Previously, she worked at the Minnesota Department of Health in several different roles, including as supervisor of home health care and assisted living program. She also served as a federal surveyor, involved in surveying nursing homes for state and federal certification. Alice earned both her Bachelor of Science in Nursing and Master of Science in Nursing degrees from our school. Please welcome Alice.
Thank you, Dean Delaney. As president of the School of Nursing Alumni Society Board, it's an honor and a pleasure to stand before you today to offer our congratulations from the Alumni Society. It is our 102nd year as an Alumni Society, and is a testament to the strength of our nursing graduates. It is in the spirit of lifelong learning, recognition of your current achievements, and hope for many future contributions to the nursing profession that the School of Nursing Alumni Society is pleased to welcome you as our newest alumni. The Nursing Alumni Society is pleased to present each of our pre-licensure graduates with the University of Minnesota School of Nursing pin, made possible with donations from the Nursing Annual Fund. The pinning ceremony is a nursing tradition that goes back more than 100 years, where new nurses are presented with the school's pins by the faculty. It represents a symbolic welcoming of new graduates into the nursing profession. The School of Nursing pin has been given to all initial licensure University of Minnesota graduates for 104 years, since September 1913. The school pin features 4 symbols representing the 4 dimensions of higher education. The antique lamp represents the metaphysical sciences, the telescope, the physical sciences, the plow, the industrial arts, the artist palette represents fine arts, and above and below the shield is the Cross of St. George, which for centuries has stood for unselfish service. May your professional practice embrace all of these qualities. Our commencement ceremony includes pinning of our graduates. Each pre-licensure graduate will be pinned by the Director of Pre-Licensure Programs, Dr. Carol Flatten. And to our postgraduate, certificate graduates, and doctoral graduates, we present you with a U of M engraved business card holder to celebrate your professional achievements. May you use this card holder with pride. In addition, each graduate will also receive a 1-year complimentary membership to the University of Minnesota Alumni Association in honor of your graduation. Moving forward, we invite you to all stay engaged with the University of Minnesota community. Come back to campus, serve as a mentor, attend our Alumni Spring Celebration next April, and of course, cheer on the Golden Gophers. Please visit the school's website to stay connected. Make sure you let us know where you're going and what you're doing. And as our newest graduates, you represent both the future of nursing and the School of Nursing's legacy. Graduates, you make us very proud. Congratulations to each and every one of you.
Thank you very much, Alice, and we're proud of you as our alum. I am now pleased to introduce the Honorable Dean Johnson. Dean Johnson is Chairman of the University of Minnesota Board of Regents. Regent Johnson has been a parish pastor at Calvary Lutheran Church in Wilmer, Minnesota for 42 years. He served in the Minnesota legislature, representing his central Minnesota district for 28 years, serving as minority leader and later majority leader in the Minnesota Senate. A brigadier general in the United States Army National Guard, Regent Johnson was special assistant to the Chief of Chaplains, National Guard Bureau, Washington, D.C. He earned a Bachelor of Arts degree in Business Administration from Luther College in Decorah, Iowa, a Master of Divinity degree from Luther Theological Seminary in St. Paul, and a master's degree in Strategic Studies from the United States Army War College in Carlisle, Pennsylvania. Please join me in welcoming Regent Johnson.
Thank you very much, Dean Delaney, and all of your efforts and dedication here at the University of Minnesota. On behalf of my colleagues, the 12 regents, which are elected by the Minnesota legislature, we want to thank you for being a faculty here at the University of Minnesota. We know and realize that you could be at many other institutions. You could be doing other things, but you're here at Minnesota. And for that, on behalf of the Board of Regents, we thank you for all of your dedication and efforts. Dr. Bean, thank you. Yes. Dr. Labine, thank you for your efforts. Ms. Kent, for your comments. Cheryl Ramstad, I've known you and your family for a long time. Congratulations. I've known you through your brother, Jim Ramstad, former state senator, my seatmate, and an honorable member of the United States Congress. Jim, good to see you. Very good. Graduates, you have been involved in your formal education for some time. It's been about biology, chemistry, physics, calculus, tests, working in hospitals and long-term care facilities, whatever. The experiences of preparing for this day. For 42 years, I have spent a great deal of time in long-term care facilities and in hospitals across the state of Minnesota. And I have observed nurses. Nurses are special people to me, and I'll tell you why. You are with families upon the newborn of a child. You are with families and patients after someone has been through surgery. You are with someone who is going through depression. You are with someone who is being the recipients of chemotherapy. What I'm describing for you are human beings that care. That's you and the nursing profession. 12 years ago, my late wife, who was a sixth grade school teacher, battled for 5 years breast cancer and lung cancer and brain cancer, and ultimately she died. But it was during those 5 years, 5 terrible years, I might add, of struggles, of suffering. Yes, the radiologists and the doctors and other staff, but it was their nurses in the hospitals and in the long-term care facilities that are a great comfort to our family and to my late wife. You're there at the most tender moments of human beings. Tomorrow morning at 11 o'clock, I'll officiate at a memorial service in Wilmer for a woman who has battled cancer for the last 2 years, age 61. As I spent the last hour in the home of Darlene and her family, upon her death, it was interesting what her husband of 28 years said to me. If it had not been for the hospice nurses, I don't know how I could ever withstood the last couple of years. I'm talking about nurses. I'm talking about you and the profession and the vocation that you are about to embark on, the profession of caring. Let me close with this quote, one of my favorite quotes, and I summarize Mark Twain. And this could be true for you, true for all of us, faculty, staff, anyone who's gathered here. In the way we live our life, Mark Twain said, "I smile at every person I meet, for I do not know what lies deep within their soul." When you walk into that hospital room or that long-term care facility, you may be the only person that's able to smile and show love, care, and concern for that individual. That's you, a nurse, a graduate of the University of Minnesota. And so on behalf of my colleagues, the Board of Regents, the legislature, the governor, President Kaler, our sincere congratulations to each of you. Thank you very much.
Will all the graduates please rise? Regent Johnson, on behalf of this faculty of this School of Nursing, I present to you these candidates as having completed the requirements for their respective programs: the Bachelor of Science in Nursing, the Doctorate of Nursing Practice, Postbaccalaureate and Postgraduate Certificates, and the Doctor of Philosophy in Nursing.
This is your moment. Upon the recommendation of the faculty and by the authority of the University of Minnesota Board of Regents, I now, Dean Johnson, confer upon you the degree for which you qualify. Congratulations, and go into the world and care.
I'll ask the graduates to please be seated. Thank you, Regent Johnson. Thank you for being with us today. We thank you for your profoundly sensitive comments that touch mind, body, and spirit. And we thank you for your commitment to serve this University of Minnesota and the state. Now at this time, exercise, I ask the Bachelor of Science in Nursing graduates to rise and come forward to be honored. Dr. Carol Flaughton, Director of Pre-Licensure Programs, and Elaine Darce, Program Co-Director, along with Alice Sanders, will give graduates their pins, while Associate Dean for Academic Programs, Christine Miller, reads the names of the graduates.
Our first graduate for the Bachelor's of Science in Nursing is Fartoon Abdi. Halima Ahmad. Sumaya Ahmad. Ayan Ali. Fadumo Ali. Emily Anderson. Jessica Axt. Trevor Barker. Lauren Bartz. Karim Bauza. Brianna Bainey. Caitlin Bennington. Ann Behrens. Danielle Berry. Yurko Besmalinovic. Blair Blanchett. Brianna Bladorn. Jennifer Bolt. Kendra Bosch. Nicole Bowers. Lee Bristow. Tweeton Bowie. Claire Boulat. Michelle Bergruff. Hannah Bussler. Jasmine Kane. Isatu Chom. Ryan Cornelius. April Darling. Kaylee Deku. Katie Desjardins. Molly Elett. Lisa Fallhaber. Allison Fegan. Irina Galeve. Jace Gilbertson. Sheena Goldberg. Christine Gorman. Stephanie Groth. Johanna Grilacki. Siham Gure. David Hall. Andy Hendricks. Maxwell Hersman. Tiffany Hill. Brianna Howard. Mandy Wong. Emily Jasperson. Afton Johnson. Nathaniel Johnson. Megan Jorsted. Helen Kaufman. Amanda Karamin. Sarah Kleckter. Colin Clemish. Libby Kritz. Kristen Cruz. Kara Kabista. Carly Lustovich. Emily Lawrence. Margaret Leary. Caitlin Lerfald. Alexis Ludke. Amanda Lonak. Abby Manitz. Wendy Martin. Joseph Masadi DeBoer. Allison Matheson. Molly Matson. Jessica McDaniel. Hilal Meyer. Caitlin Maus. Marissa Natzel. Hui Nguyen. Christine Nielsen. Tenzin Norzin. Christine Nygren. Philomena Obang Onwakwo. Caitlin O'Connor. Taylor Ohato. Hojar Jamoke Holukunlai. Yana Panokina. Caitlin Paradise. Joseph Peltier. Victoria Peter. Anna Petrovicus. Minna Pham. Kylie Pratt. Laura Radke. Jessica Rakis. Kyle Ryder. Alexis Reilly. Khadijah Rivers. Juanita Rock. Juan Rodriguez Monos. Jamie Rogstead. Kayla Royland. Danielle Sander. Darcy Schaller. Laura Shaughness. Jessica Schilling. Brenna Schmid. Ryan Schneider. Brandon Schubert. Reed Selke. Krista Seymour. Rukia Sharif. Emma Sherman. Sarah Simpson. Mara Smith. Jeanette Spangers. Robin Spano. Joelle Strand. Annika Strami. Jordan Taylor. Joseph Tiemeyer. Donna Tosh. Casey Thayer. Danielle Thurman. Lucas Tibor. Madeline Torkelson. Tyler Truex. Tuiling Wang. Jasha Wanyus. Shannon Wees. Elizabeth Wyrick. Elizabeth Westergaard. Ellen Wiggins Zimmerman. Patricia Wright. Maggie Yeater. Krista Zarling. Hannah Zawilla. Anna Zembrecki. Ashley Zimmerman. Now we invite the Doctor of Nursing practice graduates to rise and come forward, as well as the postgraduate certificate students. D&P graduates will have their doctoral hoods placed over their graduation gowns. The hooding will be performed by Dr. Judith Pakachik, who's the director of our Doctor of Nursing practice program. She'll be assisted by the appropriate faculty coordinator for each D&P specialty. These doctoral graduates will receive business card holders from the School of Nursing Alumni Society, presented by Alice Saunders. Karen Johnson, who's receiving a postgraduate certificate in nurse midwifery. Go ahead. Our first adult geral clinical nurse specialist D&P graduate is Carrie Fringer, and she'll be hooded by the specialty coordinator, Dr. Nilafar Haddadi. Amberly Hess. Elmira Turtaliva. Roberta Huna Wagner. Our first adult general nurse, primary care nurse practitioner graduate is Bethany Best, who will be hooded by Dr. Diane Willersly. Haley Ginlin. Brenna Hawkins. Jordan Carroll. Katie Luagi, and she will be hooded by Dr. Mary Derrick. Or not. Bridget Love, who will be hooded by Dr. Mary Derrick. Kathleen Otremba. Lindsay Prodell. Rachel Stainbrook. Caitlin Super. Jenna Willoughby. Our first family nurse practitioner graduate will be hooded by Dr. Mary Benbenek. Layla Akhter. Rosemary Bailey. Jenna Baker. Hannah Belfons. Ashley Bondarenko. Jessica Bruner. Christine Cody. Stephanie Hall. Melinda Mallory. Catherine Passy. Maureen Penning. Nasra Thakur. Annie Truong. Corey Vanderjacht. Naomi Widman. Our first Health Innovation and Leadership graduate will be hooded by Dr. Teddy Potter, and I also want to note that these students are getting a Healthcare Design and Innovation Certificate. Rozakadeh Daryor. Malin Andreessen. Ada Collier. Amy Holscher, who also completed a Leadership in Health Information Technology certificate. Cameron Kirsch. Shanda Lembeck. Rainey Link. Cheryl Ramstad. Eric Sandberg. Kayla Simiel. Elizabeth Wegman. Our first graduate in the Integrative Health and Healing specialty will be, these students will be hooded by Dr. Mary Jo Kreitzer and Dr. Deborah Ringdahl. Maureen Anderson. Renee Ackerman. Alicia Baker Rogers. Stacy Grenier. Cynthia Ingro. Jennifer McCauley. Our first graduate in the nurse anesthesia specialty will be hooded by Dr. Dan Lovanaria. Logan Becker. Michelle Cullen. Kelly Frost. Kelsey Cronus. You're welcome. Tyler Little. Sarah Lutz. Annie Muko. Kristen Oja. Zonghua Park. Jacqueline Poseen. Zachary Turner. Our first graduate in the graduates of the nurse midwifery specialty will be hooded by Dr. Melissa Avery. Brianna Barth. Kayla Fuller. Aaron Gallagher. Dominique Jones. Megan King. Annie Lilligren. The next graduates are in the specialty of nursing informatics and will be hooded by Dr. Karen Monson. Alex Knutson Smishek. Lily Tonby. Maya Bastinen. And I'm sorry, now we're going to the pediatric nurse specialty, and these students will be hooded by Dr. Sherry Friedrich. Maya Bastinen. Carrie Bodensteiner. Jessica Brabender. Kirsten Dougherty. Alejandra Eppinger. Erica Lundberg. Emily Roskus. Amy Toberman. Sean Wedland. Our next graduates are in the specialty of psychiatric mental health nurse practitioner and also completed the integrative health and healing specialty. These graduates will be hooded by Dr. Mary Koss and Dr. Debbie Ringdahl. Rebecca Beasy. Rachel Bukema. Melanie Burke. Eleanor Chase Andreessen. Elena Geiger Simpson. Anne Gershon. Kristen Kelly. John O'Donnell. Courtney Olenichek. I don't even have to look. Dina Stewart. Jamie Tunis. Brandy Williams. Our next graduates are in the specialty of public health nursing and will be hooded by Dr. Mary Findorf. Amayehu DeRose. Bethany Devakaran. Dana Janowiak. Our next group of graduates are in the Women's Health Nurse Practitioner specialty. They'll be hooded by Dr. Diana Drake. Sarah Block. Jade Buttweiler. Allison Cadlitz. Amanda Rinda. Cassandra Smith. Our next students finished their postmaster's Doctor of Nursing Practice degree, and they will be hooded by their project advisors. And in this case, it's Dr. Melissa Avery and Forrester Page. Nicole Nelson. Lisa Starr, who will be hooded by her project advisor, Dr. Mary Jo Kreitzer. Finally, I invite the 4 Doctor of Philosophy and Nursing graduates to please rise and come forward. These PhD graduates will have their doctoral hoods placed over their gowns by their dissertation advisor and Dr. Jane Fulkerson, director of the PhD program. In some cases, they have 2 advisors, and those 2 advisors will hood them. The titles of their dissertations are listed in the program. Going first. Jessica Peterson, who will be hooded by her dissertation advisor, Dr. Karen Monson. Dr. Lisa Moon will be hooded by Dr. Daniel Peschet and Dean Connie Delaney. Sohee Lee will be hooded by her 2 advisors, Dr. Ruth Lindquist and Dr. Erica Shore. Savannah Zins will be hooded by her 2 advisors, Dr. Cynthia Gross and Dr. Casey Hook.
Let's join and congratulate our 247 graduates. To close our ceremony, we ask those who are able to stand and sing. Together we will sing Hail Minnesota. You will find the words printed inside the front cover of your program. Please be seated. And we ask that you remain seated until the faculty, dignitaries, and all of our graduates have exited the hall. We invite you to join us for a reception immediately following this ceremony. Thank you.
sitting there, right? Let's do a third prop and circumstance march. Third march. Make sure you got the third one, not the second, not the first. In 4. March in 4. Ba-rum, ba-rum, ba-rum. 2, 3, and.